Type 2 diabetes is one of the fastest growing diseases. The number of people affected by diabetes will soon reach 552 million worldwide. The associated increases in complications and healthcare expenditure. Lifestyle, medical, and nutrition therapy are considered the keystone for type 2 diabetes prevention and treatment. Risk factors for this progressive disease include family history, genetic linkage, hypertension, hyperlipidemia, obesity, and sedentary lifestyle. It is more prevalent among African Americans, Asian Americans, Hispanics, and Pacific Islanders. However, this prevalence is thought to have much to do with diet and lifestyle as well. Today, we will be examining the clinical presentation of a typical and recently diagnosed type 2 diabetic patient. Let's take a look.
Hi there, Sugar Plum. My name's Frank. I'll be your nurse working with you today.
Hi, Frank.
How are you feeling today?
I've been feeling pretty exhausted lately.
So what seems to bring you in today?
Well, I've been really hungry. I've been eating a whole lot. I've been really thirsty, too. I've also been peeing a lot. I just run over to the bathroom. And, I've also been getting a lot of recurrent infections, and that's really scary to me.
You know, Miss Sugar Plum, you seem to me that you're displaying the hallmark signs of your type 2 diabetes. These are not specific to type 2. They also occur in type 1, but as you know, can be seen with your type 2 diabetes. Recurrent infections often happen in type 2 because of the high blood glucose levels that you have, which serves as a great medium for the bacteria to grow and thrive. Additionally, poor wound healing can also occur, which is known.
As we can see, Sugar Plum has already been diagnosed. However, along with the subjective information regarding lifestyle as well as clinical manifestations, some diagnostic testing is required. Let's talk. The American Diabetes Association recommends testing for type 2 diabetes in adults of any age who are overweight and have a BMI of greater than 25 and who have one or more additional risk factors. If a patient presents with hyperglycemic crisis or clear signs and symptoms of hyperglycemia with a random plasma glucose greater than or equal to 200 milligrams per deciliter, no further testing is warranted. A1C measures the percentage of glycosylated hemoglobin, which is dependent on blood glucose levels. When these are elevated over time, the amount attached to hemoglobin increases and remains attached for the lifespan of the red blood cell. This gives us valuable information regarding patient glucose control over the previous 2 to 3 months, as well as information related to the treatment efficacy. Other diagnostics are based solely on the blood glucose reading of the patient.
So, tell me how this diabetes works.
Well, there are 4 key physiologic factors that contribute to your condition. Let's meet Paula, the pancreas, Allie adipose, and Louis the liver to find out just how that works.
Howdy y'all, I'm Pancreatic Paula. Resistance to insulin action in the peripheral tissues is generally considered one of the first steps in type 2 diabetes. Usually the pancreas continues to produce some endogenous or self-made insulin. However, the insulin that is produced is insufficient for the needs of the body or is poorly used by the tissues. Therefore, there's marked decrease in my ability to produce insulin.
Thank you for that, Paula. Keep in mind, the presence of endogenous insulin is a major key distinction between type 1 and type 2 diabetes. Next up,
Louis the liver. There is also increased hepatic glucose output in the type 2 diabetic.
Look at the flick of their wrist. Look at the flick of their wrist. Look at the flick of their wrist. Look at the flick of their wrist.
I'm Allie adipose. There's also altered production of hormones, and cytokines in adipose tissue.
So, Frank, what if I don't get this treated? Do I die? Do I lose a leg?
Listen here, Sugar Plum. There are both micro and macrovascular changes that occur, along with neuropathy and recurrent infections.
Ah, crap.
Let me break it down for you. The glucose in your blood is like sandpaper. The constant rubbing of the sandpaper causes inflammation. and it causes things to get really sticky and like reduce the blood flow, which is just not good. So macrovascular changes that occur can be heart attack, stroke, peripheral vascular disease, and also hypertension. The microvascular, which is the smaller changes, those are the small vessels, can be retinopathy, neuropathy, nephropathy, and dermopathy. In short, you may have vision changes, reduced kidney function, and some numbness and tingling, along with poor wound healing.
Well, I do get a warm and tingly feeling when the cheesecake comes by, but that's probably not what you're talking about.
No, that's not.
What is this? What happens if I get this neuropathy you speak of?
Neuropathy can lead to further complications, most often in the feet. Neuropathic edema or painless ulcerations of the feet are most common. Reduced sensation in your feet, yes, down there, can have impacts, and you can have prolonged wound healing associated with it, and also tissue death from the reduced blood flow, and that can cause recurrent infections.
Oh, well, I didn't sign up for an amputation, so I better check my feet out daily and stop walking in the dirt barefoot.
Yeah, that's a pretty good idea. That's a great place to start, because diabetics and their feet, that's probably the most important thing. So you really want to check those daily and continue to keep up good hygiene.
Okay, well, get to the point. Any drugs I need to take? How can I get rid of this?
Well, let's make a call to the pharmacy.
Hi Sugar Plum, let me tell you a little bit about metformin, otherwise known as Fortimet or glucophage. You'll be taking this by mouth twice daily in doses of 500 milligrams. It's an anti-diabetic biguanide that decreases hepatic glucose production and intestinal glucose absorption while increasing sensitivity to insulin. This will help control your blood glucose by eliminating excess production while getting the glucose that's present into your cells for use. The onset and peak of the medication are unknown. It lasts 12 hours and the half-life is about 17 and a half hours. Like any medication, it does have its side effects.
Some of these include abdominal bloating, nausea, vomiting, diarrhea, and unpleasant metallic taste. Lactic acidosis and decreased vitamin B12 levels may also result. Alcohol intake increases the risk of lactic acidosis. Digoximorphine, calcium channel blockers, and vancomycin may compete for elimination pathways with this drug, causing altered responses, and furosemide may increase the effects of metformin. Frank! Are you still there, Frank?
Well, still here. That was a mouthful.
A few nursing considerations for you in taking care of the patient on metformin include assessing patients who have been well controlled on this medication for lactic and ketoacidosis. Also, before giving the med, assess renal function. After the patient has started therapy, monitor blood glucose levels and A1C to evaluate treatment effectiveness, as well as folic acid and vitamin B12, because there may be interference with absorption.
Yes, Mariah, that reminds me, Sugar Plum. It's essential that you take your medication at the same time every day and take missed doses as soon as possible, unless it's close to the next dose. Additionally, it may be helpful to take metformin with some food to minimize an upset stomach or GI discomfort. Remember, metformin helps control your hyperglycemia, the glucose in your blood, but does not cure your diabetes.
Sugar Plum! Sugar Plum! Hi, my name is Claire. I'm the dietitian here. I'm talking to you about your diet and exercise regime today. Modifications in this area is one of the single most important things in the management of your disease.
Talk to me, Claire.
Well, tell me a little bit about your diet. What have you eaten in the last 24 hours?
Well, I've been really impressed with my diet lately. I've been incorporating the protein, the vegetables. It's been great.
Did you know over 80% of type 2 diabetic patients are overweight? Excess weight decreases the effectiveness of insulin, leading to excessive glucose in the bloodstream, whereby the body produces more insulin to compensate.
Go ahead.
Hi, what can I get for you?
Hi, can I get the diabetic number 3 and can I get 2 patties on that and make sure it's got lettuce and some fries too, because I need those veggies and that protein.
Well, that's not exactly what I had in mind. I'd like you to transition your diet a little bit. This may be challenging at first, but it's going to pay off. I recommend including a minimum of 130 grams of complex carbohydrates. This includes from vegetables, fruits, grains, legumes, and low-fat milk. Also, incorporating 25 to 30 grams of fibers a day is beneficial.
Oh yeah, that'll help me clean out the tubes, if you know what I mean.
Your protein intake should be at least 15 to 20% of total calories, and you need to limit your saturated fat to less than 7% of total calories. Cholesterol should be limited to less than 200 milligrams per day. Lastly, I'd like you to aim to reduce alcoholic beverages to at least about 1 drink a day or less.
It's important for you to have a balanced diet throughout the day with smaller, frequent meals with snacks in between. This will keep your blood glucose from fluctuating too much. Now we're going to talk about exercise. Exercise! Along with diet, regular and consistent exercise is also an essential part of diabetes management. The ADA recommends at least 150 minutes per week of moderate to vigorous aerobic exercise. This can be broken down into 30 minutes 5 days a week. In addition, it's recommended that you incorporate resistance training 2 to 3 times per week. Exercise decreases insulin resistance and can have direct effects on lowering blood glucose levels. Regular physical activity may result in a decreased need for diabetic medication to achieve.
There's always gonna be another mountain. I'm always gonna wanna make it move. Always gonna be an uphill battle.
Hey there, Sugar Plum.
Hiya there, Frank.
How you feeling today?
I'm feeling great.
Well, you look great, and I see that your A1C has come down quite a bit, and so that's right on. You're right where you need to be.
Yeah, I feel awesome. I modified my diet, I started exercising, and now look at me. Next stop, Vogue magazine.
Story. Type 2 diabetes is surely a life-changing diagnosis not to be taken lightly.
However, with gradual changes in lifestyle and diet and a medication regimen fit for you,
You can lead a normal and fulfilling life.
With so many options for emotional and physical support,
you can kick diabetes